this is the clavicle. It's got an S shape to it, and that's all you have to know about it. This is the scapula. Remember, this is your shoulder socket, so this is going to be medial, and it goes with the curve of the back of the shoulder. This is the glenoid cavity with the coracoid process and the acromion. Then you have the three fossa. Here's the spine. Above the spine is the supraspinous fossa. Below it is the infraspinous fossa. And then on the back side or the front side or the bottom side is the subscapular fossa.
And we don't have to label the spine, right?
No.
It's not, okay.
All right, moving down the arm, we have the humerus. The head of the humerus fits into the glenoid cavity of the scapula. So you know that this is proximal and that this portion is going to be medial. Here's the head. The neck separates the head from the rest of the bone. On the opposite side from the head, you have the tubercles. Okay, so if you cover up the head, the greater tubercle and the lesser tubercle. The only thing on the shaft of the long bone is a tuberosity. The one on the humerus is called the deltoid tuberosity.
And that's the rough patch.
Yep. Moving down, we have the epicondyles. Okay, the one on the same side with the head is the medial epicondyle, and the opposite side is the lateral epicondyle. In between the two is a pit called the olecranon fossa, which will fit the olecranon process of the ulna. Olecranon fossa. The ulna is the U-shaped bone, or the top of it's the U shape. And so this part goes to the elbow, so this is proximal and this is distal. The tip of that U is the olecranon process. The distal end is called the head, with the very pointy tip being the styloid process. The radius is the one that looks like the thumbprint on the top, that's round at the top, and it will spin on the side of the ulna. So you know that this round portion is the proximal towards the elbow, and this with the pointy part is going down towards the wrist. The head of the radius is the proximal part, it's the round part, and then the neck is the narrower portion that separates it from the rest of the bone. And then this is again called the styloid process, the tip. All right, we have our hand. Hand, you need to know the hamate, which comes forward, and the pisiform, which is the P-shaped one on the pinky side. Metacarpals, and then phalanges. For the foot, and this is not the best foot, but for the foot, okay, you need to know calcaneus, which is the largest, it's the heel, and then the talus, which has the smooth part on the top, and then metatarsal and phalanges.
Okay.
We come down to our hip bones. Okay, we'll use either model. Remember that it starts off as 3 bones. So if it says identify the bone in a child, you want to put ilium, ischium, or pubis. Ilium, ischium is the back lower part, and the pubis comes towards the midline. The way to recognize this on the single bone is you look at the hole. The back side of the hole is much thicker and wider. That's the ischium. And then the 2 more slender parts that come together form the pubis. The features, all the features on the ilium portion have the word iliac in them. So the iliac crest, and then the iliac fossa is the basin. Moving down, the hip socket is called the acetabulum. And the back side of the ischium, you have the greater sciatic notch and the lesser sciatic notch. The large hole is called the obturator foramen. And then when the 2 are together, you've got the pubic symphysis, which is the fiber cartilage, and the pubic arch. Moving down, we have the femur. Okay, you know that the head of the femur is going to fit into, well, this is the wrong one, but the head of the femur is going to fit into the acetabulum or the hip socket. So that tells you that this is the proximal end. It also tells you that this is the medial portion of the bone. This is the head. The neck separates it from the rest of the bone, so now it's right here. There's an indentation in the middle of the head called the fovea capitis. On the opposite side are the trochanters. The one directly across from the head is the greater trochanter, and the one below is the lesser trochanter. On the shaft is the gluteal tuberosity, the rough patch, which attached for the gluteal muscles. And on the distal end, you have the condyles. Okay? The condyles are the smooth parts of the lower portion. They're called medial and lateral. I recommend that you use the head as your reference point. So this is medial, it goes into the hip socket, making this the medial condyle and this the lateral condyle. The epicondyles are on the sides. So this would be the medial epicondyle and this would be the lateral epicondyle. And the condyles articulate with the condyles of the tibia. You will know the tibia because one end comes to kind of a flat surface where it looks like kind of a heart or oval shape. The tibia is the medial bone in the lower leg, so when you look at the distal end, it comes to a point. This has to be on the medial side of this bone, so this is the very innermost part of the leg. So when you go to label the condyles of the tibia, you follow this tip, so this is the medial portion, and you follow it up, and that makes this the medial condyle, and this the lateral condyle. The tuberosity is the little bump right here, and this time it's just called the tibial tuberosity, and that's the feature on the tibia. It's pretty easy. Then you follow down, and this little pointy part, or the tip right here, is the medial malleolus, because again, the tibia is the medial bone. The lateral malleolus will be on the fibula, which is right here. The fibula is long and thin and about the same on both sides. If you look closely, one end will seem to be a little bit more blunt or round or blockish, and the other end will seem a little bit more tapered. Both will come to a point, so you have to ignore that point right there and look at what's happening to the rest of the bone. And you'll see that this end is a little bit more round or blunt. So this is the head and this is the neck. On the other end, even if you take this part off, it's still going to come to a taper. It's still going to come narrower and narrower as you get towards the tip. So this is the distal end and that's the lateral malleolus. That's it.
Yay!